Oh yeah, Sickle Cell been kicking my ass lately, but you know what it is. One day at a time. Oh, this shit sounds small. Might as well jump in this. Look. Sickle cell to the bone, sicker than the rest. I done been through hell and back, still feeling fresh. You could never check a nigga that'll check death. My own body seems to hate me, so I like the threats. Got a key from the pain, it's just a pimp step. The only time you see me down is when I'm thinking that. I like the pain, could you handle all the chronic steps? Phone flex, dropping bombs on these niggas' necks. Sickle cell, sickle cell. Raising hell in my body, yo. Sickle cell, sickle cell. Every day a different pain, so I'm tired, bro. Sickle cell, sickle cell. Fuck you, I'm still gonna be the flyest, though. Sickle cell, sickle cell. Raising hell in my body, yo. Cells a time bomb, veins see the flying squad. Without a warning, pain receptors ringing no alarms. Still calm, not the battle in the ER. Doctors hate when they see y'all. Another addict make me ask for the seesaw. Up and down, closer to the reaper. Sorry, but I hate to be y'all. Call us seekers, no brothers keepers. This shit gets deeper. Shit, I'm just speaking to the speakers. Sickle cell, sickle cell. Raising hell in my body, yo. Sickle cell, sickle cell. Every day a different pain, so I'm tired, bro. Sickle cell, sickle cell. Fuck you, I'm still gonna be the flyest, though. Sickle cell, sickle cell. Raising hell in my body, yo. Live your life, I know it's painful through the fighting. Gotta make the most, you know we warriors for life. Get right, dream big, take flight. Aim for the stars, shine brightest through the night. See them doctors don't believe me, we all stand up for our rights. Never take a knee, I'd rather smack the murder stripes. Sickle cell general, just put me in the fight. Bowing out gracefully, you know I'm yelling tight. Sickle cell, sickle cell. Raising hell in my body, yo. Sickle cell, sickle cell. Every day a different pain, so I'm tired, bro. Sickle cell, sickle cell. Fuck you, I'm still gonna be the flyest, though. Sickle cell, sickle cell. Raising hell in my body, yo.
Woo.
Tony's supposed to be coming, y'all. Hey, y'all.
Hey, Miss Anita.
Can y'all hear me?
Yeah. Okay. Hey. Welcome to the 2020 Warriors panel. Tonight we are going to be talking about sickle cell anemia disease, discrimination, the lack of medical care, the needless suffering, the unnecessary deaths, and the opioid crisis and how it has affected us. We all have fought this journey long and hard. So with the recent death of our brother Channing, R.I.P. Channing, it had been nagging at me to do this YouTube panel. So I want to welcome everybody here, and I
sound real low.
Do I?
Sound real low.
I can hear you really well.
Hold on.
Yeah, she don't sound low to me. She coming off low to y'all?
No, she sounds great to me.
How is that? Is that better?
You were good the first time.
Am I good now, though?
Yes, you're good.
Yeah, you're good. I can hear you.
You sound low, James.
StreamYard.com. It's like real
Maybe
low.
you want to go out and come back in if you're low, but I'm
gonna try to leave and come back.
Okay. James will be back with us, but while we are doing that, I would like to introduce our panel. We have some more people who are supposed to come. I think Tony is trying to get it figured out. Darrell is somewhere asleep. So Darrell, I hate that you're gonna miss this panel, bro. Maybe you can catch the next one. But without further ado, I want y'all ladies to introduce yourself, and then once bro come back, we'll allow him to do the same. Hey everybody.
Hey, Miss Benita.
Okay, so you can go first, Shay.
Okay, so As everybody knows, my name is Shay. I'm Sharon, but everybody calls me Shay. Family calls me Shay. I have sickle cell beta thalassemia. Have been discriminated against and everything else with sickle cell. I've been a nurse now for about 34 years. Just recently completed my degree in healthcare administration because I want to make some changes when it comes to us as patients with sickle cell disease. So the first thing that I need to do was get that degree, that advanced degree, so that I can start making some changes. I have worked, never worked on a sickle cell unit, but as a patient, I have received discrimination in the emergency room, in the doctor's offices, at the clinics, until I found the right people who I'm currently receiving services under. Shout out to Mount Sinai Sickle Cell Program in Harlem. They do a fabulous job. For anybody who's in New York, you need to check them out. They're really, really great. My biggest thing right now is fighting with my insurance company about approving treatment. So my next advocacy, if you will, is working with the insurance companies for them to understand that money is not always everything. They're trying to deny me so the new treatment that was just approved for sickle cell disease, so they're trying to deny it. Not only are they trying to deny, but they're trying to deny where I can have it. So since last week, I have been fighting with them and still fighting with them, but we have to be our own advocates sometimes, and that's where I am. It's good to be a part of this panel, so thank you for inviting me, Ms. Benita.
Good to have you, sis. It's so good to have you. And like I was telling you the other day, I think that it would be awesome to have you on this panel so that we can hear both perspectives. We don't get the medical, the side of the medical professionals a lot of the time. So it's really good that, you are blessed enough to be able to see both sides of it so that you can help raise, awareness on the medical side of it too, because a lot of times, I hate to say it, but the nurses and the doctors, they become nurses and doctors and they forget, where they came from. And a lot of times they don't advocate or for us or help us. So Lucy, go ahead and introduce yourself and then we'll get broke.
Hi, my name is Courtney. I have sickle cell SC. I'm the executive director of Sickle Cell Hush, which me and Benita, she is my assistant director, started that 5-6 years ago. Basically, what we do is we help warriors who are being discriminated against in a hospital setting. Also, we started founding member of LNC, which is a sickle cell entertainment group, but it's basically become a family. And what we do is entertain each other, uplift each other's spirits when we're down. And now at this point, we're doing annual trips to get to see each other because, we pick destinations because we've all in that community on Facebook. There is a sickle cell community on Facebook, and most of us have gotten to know each other, and we're in different states, but we only see each other or be able to talk to each other over the phone. So we decided that we needed to try to come together. And what we do is we come together in different states annually every year to meet each other, because tomorrow's not promised, and unfortunately things happen to us that are unfairly or unjust, and so this is a way for us to always kind of come together, get to see each other, get to meet each other, because we never know and what's going to happen basically. So that's pretty much my thing.
Okay, bro, your turn. I'm trying to get Tony in, y'all. He is just not getting the concept of this. But if I'm looking down, excuse me, it's because I'm trying to guide him and onto this live. But go ahead, bro.
So I'm James Duncan. I have sickle cell SS. Like what everybody said, we've all sat there and dealt with doctors treating us unfair, nurses treating us unfair, insurance, what Shay said, they are the worst right now. Like they don't look at us as chronic. They look at it as an outside perspective, like a person with just a bad back or something. So we're all going through pretty much the same thing with the prior authorization and having to fight with them continuously every single month, pretty much. And I guess this is just a great way to sit there and get the word out. So shout out to y'all.
So true, bro. So I'm gonna allow Trina to introduce herself, and hopefully maybe Tony will be here by then. But if not, I'll go ahead and introduce myself after Trina and talk a little bit about my journey, and then we'll get into the other stuff. So go ahead, Trina.
What'd you say? Sorry, I'm in the car.
Everybody was introducing themselves. I was asking you to introduce yourself.
Oh, I'm sure.
I was asking you to introduce yourself for everybody.
I'm Trina from Jersey, 44, and Sickle Cell.
That's it. That's good. Don't worry about it.
Hi, I'm Katrina.
Okay,
I'm
so
Move on.
She was like short and sweet and to the point. Like I'm Katrina. I got sickle cell. Okay, so
what else?
My name is Benita. That you don't just whatever you want to say. It really didn't matter. Whatever you wanted to say. But my name is Benita. I have sickle cell SS. I am a well-known advocate in the sickle cell community. Like Courtney said, we worked together for years. We both met due to our passion for our illness and wanting change. Growing up, when you're in pediatrics, you're sympathized with more. And the nurses, it seemed like they're nicer and they understand and, oh, poor you. Whereas once I got into adulthood, I experienced the opposite of that. I experienced the discrimination. I can remember, doctors, doubting the amount of pain that I was in, and I was really in pain. I can remember a doctor telling me, "Oh, you can't be in that much pain. It just can't be that bad." And at that particular time, you deal with so much stemming from sickle cell. It's like you're already battling pretty much to stay alive. You add in doubt from doctors. It kind of make you question yourself, and you start to feel like a burden. A lot of the times I felt like a burden to my parents, to my siblings, because I depended on the doctors to, I was so used to them having my back in pediatrics. Once I got to the adult side, I wasn't schooled on, okay, Benita, well, once you get to adulthood, it's going to be a whole different ball game. They're going to start questioning the amount of pain that you're in. So that was a really rude awakening for me. Like, it hurt my feelings. I can remember, like I said, I felt like a burden. I can remember not really even wanting to be alive, because I felt like a burden to everybody around me, and so, and it was just off the fact that doctor questioned the amount of pain that I was in, like the emotional impact that it have on me, and especially when we're teenagers, we're just getting into the adult side of things. Like, you depend on them to have your back, and the fact that they didn't, like, it really took an emotional toll on me. Anybody want to add anything?
No, it's definitely true.
No, go
That
ahead.
that rude awakening is real. That rude
Was
awakening is
it,
definitely
yeah,
real.
was it the same thing for y'all? Like, because I know for me, it was just like I was in pediatrics, and then it was like adult into adulthood, and then it's like this whole different ball game where I can remember my mom having to come up to the hospital and cuss doctors out. I can remember like all of that, and like, it tears down your self-esteem too, because it's like, dang, like, the doctors who are medical professionals, if they don't believe me, nobody else is gonna believe. And so it's like it made me really self-doubt and really question my own self. And I knew I was in pain. That's the crazy part about it. Like, I knew that the pain was severe. It was just not feeling supported by the people who are supposed to support us the most. Like,
Right.
that was detrimental to me.
I was warned, but I was warned through going to sickle cell camp. But when they warned me, like, oh, you're going to transition and it's a different ball game when you transition, I didn't believe them because my care was so good. I'm like, doctors don't treat you like that. Nurses don't treat you like that. Y'all tripping. Maybe y'all doing something wrong. You know what I mean? Like, I had people telling me this, and I tell you, I think my first rude awakening was basically basically I was in the hospital and they were giving me morphine. I was in a really bad crisis. And it was this one doctor and they were giving me morphine after more and it just was not working anymore at all. And they just were like, well, she just cannot be in, the same thing. She just cannot be in this amount of pain. Like, and my mom was up there literally fighting with this doctor to increase it or change it or anything. And he would not do it. And so she got mad and called my dad. Anytime she got to call my dad, she can't do it. It's a problem. I mean, it's going to go down. She has to call my dad. So my dad gets up there and he's going off on them, and they finally switched my doctor. They switched the ER doctor, and then the new doctor that came on was actually nice. He was nice, and he ended up switching me over to the Dilaudid, and that was the first time I got some relief. But it took about 3 or 4 hours for that to happen. Because I had this one particular doctor who just failed to believe that I was in that much pain.
But I can't.
And so that was my first rude awakening. And I mean, it's unfortunate because nobody can understand that pain unless you have it. You get what I'm saying? So you're in there
Exactly.
rolling around, trying to catch your breath, trying to do anything to calm yourself down. And those medical
Hello,
professionals
can
should be
y'all hear me?
there helping you, but instead they're doubting you because of something called a narcotic. And because you have this is
No.
the only thing that will ease your pain, they look at you
We can hear
and not
you.
not not to mention your skin color plays a part, okay? So now you have that
It
working
does.
against you too. All right. So not to mention that plays a part. And then they hear narcotic and then they automatically go to, well, she's don't be there multiple times. You get what I'm saying? Oh, she's here too much, or it's a problem, or she can't be in that much pain. All she wants is the medication. And it's like, listen, and I say this shit all the time. If it was just about a high, people do that on the streets all day. Nobody wants to go and deal with being discriminated against and have to deal with nurses and doctors whispering about you or assuming the worst about you, and you're in there suffering in in a 10 out of 10 pain, as they say. But we all know that shit gets off the chart past the 10. You know what I'm saying?
Exactly.
That we all know that they need to change that anyway. But they can't fathom that. You know what I'm saying? And so they get to judging you and they get to assuming, and it's unfair.
Yeah.
I'd like to
So
just
for
piggyback off of something that
I
My
wanted.
situation is a little bit different.
could I
Oh,
just
go ahead,
piggyback off
doctor.
of something that Courtney mentioned?
Yes.
So, um, from both perspectives, right? So, as a patient, I have experienced where nurses, because when I go to the hospital, I don't announce to anyone that I'm a nurse or that I'm in the medical profession. I don't do that. And I do that for two reasons. One, I want to see what they're about. And two, I want them to be their authentic selves so that when I start to write them up, I'm writing up their authentic self. Um, One of the things that and I'm glad that Courtney touched on her transition from, learning about it at camp. One of the things that I wrote about in my thesis a few months ago was transitioning patients, young people from, the pediatric clinic to the adult clinic. And one of the things that I wrote about was the fact that we, as adult sickle cell patients, we utilize the emergency room much more often than other people simply because we were not transitioned properly, meaning that we don't go from a pediatric doctor to an adult doctor. And what I have learned through my research is that they don't expect us to live long anyway. So because they don't expect us to live long anyway, there are not that many hospitals or clinics available that have adult sickle cell um, practitioners. And so I find that one of the ways that we can help to do that is by helping to, before you turn 18 or even before you turn 17, if you know anyone, is to try to help them. Being part of the advocacy is trying to help link them with adult practitioners that do sickle cell, because you don't have a lot of them. The other thing is that they don't believe that we as Black people experience pain. If you read the study that was done at Virginia State by the residents in the medical field, they believe that Black people feel pain less than white people, which is why they are treated faster and more effectively than we are. Because I don't know if it's because we, survived slavery and whippings and all of these other things, that they believe that our skin is tougher, that our fortitude is tougher, that everything about us is tougher. So when we say that we're in pain, we are not experiencing the type of pain that we claim, and I've used claim in quotations because that's the word that they use, that we claim that we're in pain. So one of the things that we have to fight against is the preconceived notions that, one, Black people don't feel pain, two,
Exactly.
that sickle cell pain is not as bad as it is. And three, we need to advocate that um, these medical students spend more than a half a day or a day or a day and a half studying hematological disorders, and spend more time understanding the etiology of sickle cell, where it comes from, what happens to the body with it, and why we die so frequently from it when we don't receive the proper treatment. It's like, I don't understand. It's all over the internet. It's in, medical books, but it's killing all the right people, is what I've always said. And it's annoying when you try to educate someone who's gone through 4 years of medical school, 4 years of residency, is now in their specialty, and they still don't get it.
Exactly.
That's the annoying part. That you, as a person who knows about your disease process, now has to take the time to educate somebody who should have been studying about this while they were in medical school. And so we're suffering. We're not getting our treatment. We're not getting our medications on time. We're not being believed by our physicians. We're not being believed by emergency room staff. I only have one doctor in the emergency room that said to me, Miss Bailey, anytime I see that you come to the emergency room, I know that you tried everything before you come here. And as long as I step in the ER and I see his face, I know that I'm going to get treated fairly because he takes care of me right away. But then you have the others who, like nurses, one nurse looked at me and told me, when the doctor ordered medication at midnight and he came at 5 a.m., he was like, oh, well, that's unfortunate. I said, no, what's unfortunate is when I write your ass up to nursing administration, when I write your ass up to the Department of Health, when I write your ass up to the Department of Education with your license number and tell them how you've been treating patients, because if you do it to me, then you've done it to somebody else. That's unfortunate.
Exactly. And so can we kind of backtrack a little bit? Because like I said in my live, there are still people who do not know what sickle cell anemia disease is. So do anybody care to explain exactly what sickle cell anemia disease is and some of the complications? Anybody? Okay, so let me back up.
Cell disease is.
Go ahead, sis. I'm gonna let you do it.
So
Go ahead.
sickle cell disease
I was gonna
is
say she should do it anyway since she has the nursing background.
No, Miss Courtney, that should have been you because you and Miss Benita.
No, well, let me let Shay get this one. Go ahead.
No, go ahead, Miss Courtney, and I'll fill in when you're done.
On what you touch on after you start.
Okay, all right.
Yeah. Okay.
So it's a hereditary. Okay, it's a hereditary blood disorder that is caused by one parent having, depending on the genotype of the parent, you can have one parent who has, like in my case, thalassemia, and another parent who has sickle cell. And it has to do with the shape of the cells. I'm just breaking it down without going into the whole thing, but it has to do, it's a hereditary disease with what they call hemoglobin anomaly, where the shape of the hemoglobin causes the blood vessels to be blocked. Many times, because of the blood vessels being blocked, we have organ death or cell death, which leads to organ failure. I think one of the things that they don't understand is that sickle cell is a hereditary disease. So please stop asking me, how long have you had it? That's one. It is a disease process that, because of the nature of the disease, meaning that the cells are blocking the blood vessels, the hallmark sign of sickle cell disease is pain. And when you do, the hemoglobin breakdown, it's very easy to tell if a patient has sickle cell or not. Because for a long time, they used to tell me, no, you don't have sickle cell. You just have thalassemia. And I'm like, okay, so if that's the case, can you please tell me why for like 22 years I was told that I have sickle cell beta thalassemia, and when you do the breakdown, this is what it is. So basically it's a hereditary disease where both parents have to have the gene for sickle cell. Both parents have to have the gene in order for you to have any form of sickle cell, whether it's sickle cell C, beta thalassemia, sickle cell D, SS. Both of your parents have to carry the gene for you to have it. It causes a misshaping of the red blood cells. And the red blood cells are the blood cells that carry hemoglobin that's attached to it. The reason why our hemoglobin is low and our oxygen levels are often low is because the shape of the cell cannot carry the oxygen. The oxygen is round, the hemoglobin is round, it's supposed to sit on top of it. It cannot if your cells are shaped like a crescent moon. And that's what causes the blood vessels to become blocked because they're not able to pass freely through the blood vessels. And when we have crisis pain, it's caused by the fact that the blood vessels are blocked up and the blood is not flowing, and there's a lack of oxygen going to whether it is to the heart, to the lungs, to the bones, wherever there is that blockage, that is, what it is that's causing pain. Some of the complications of stroke, pneumonia, acute chest syndrome, renal failure, peripheral vascular disease, chronic venous insufficiency, where you develop wounds in your lower extremities. Um, you can have a brain infarct, you can have a lung infarct, you can have bone infarct, which is what causes us to have our joints replaced. And so when we are ignored and our pain is not addressed and we're not treated effectively, it can also lead to death. Take it away, Miss Courtney.
She said a mouthful.
Sorry, I was muted. Okay, so I'm gonna
Oh,
just touch on something that she was saying because you guys can't see her, but Nita's putting up pictures and stuff. Okay, so basically with the cells, when we're talking about the red blood cells, okay, so what happens with the pain and why we get the pain is that our red blood cells are the circle shape, right? Like this. I don't know if y'all can see me. Okay, there you go. Circle shape, right? Right there, circle shape. Okay, so when we go into a sickle cell crisis, when the pain starts, it's because our cells are changing shape from circle to that crescent moon shape, like a hook or maybe a banana shape, like you see in this picture that she's showing, like this. All right. So when we go from the circle, that circle to this is what's causing the pain. Okay, and that can occur anywhere in your body if you have sickle cell. So that can occur in your feet, that can occur in your legs, that can occur in your back, your neck, your hands. You ask any sickle cell patient, they can tell you exactly majority of the time where their pain is. Everybody has different places where it comes majority of the time. When you're a baby and you have your first crisis, they normally say it's the hand and feet syndrome, and you would get that's the signs of going into your first crisis: the swelling in the hands, the swelling in the feet. Okay. Um, so, like I said, that can occur anywhere in your body. Um, it causes. I want to say the signs are different for everybody who has sickle cell, but usually you can start. It can occur from being cold, too cold, um, getting in a cold swimming pool. All right. That's why if you ever see a sickle cell patient having a lot of heat on or heating pads or a lot of blankets, that's because the warm helps. Okay. Um, it can be caused by being stressed out, overexerting yourself, being dehydrated, um, a, a common cold, an infection, any kind of infection can cause a sickle cell crisis. Um, and any type of cramping can cause a sickle cell crisis. Women, usually when we have our menstrual cycles and we go into cramping, that can cause a sickle cell crisis. So it's a lot of things that could basically make you go into a crisis. But those are some of the things, and everybody's different. I know for me, um, if I'm dehydration is probably the number one thing I can say. Stress will probably be another one. Overexerting yourself, and just maybe not eating healthy. That can be another one. It's a lot of things. Infection, all of those things can cause you to go into a crisis. And so, like I said, when that happens, it can occur anywhere in your body. Then you get to, she touched on bone deterioration. So basically that
There
can
you go.
happen in your hip, the AVN, the avascular necrosis. That can happen in your shoulders and your hip. James will probably be able to touch more on that because he just had his hip replaced from having AVN. So James, go ahead.
That's crazy. Who's putting those pictures up?
Nita. James, go ahead.
My foot don't look like that.
I think you're muted. Do you want to
Yes,
touch
it
on it or you
does.
didn't want to touch on it?
No, I'm saying my feet don't look like that. Like, what
Is
is
he
that?
muted? I
Like,
can't hear him.
he got into a motorcycle accident?
She said, he said, it
That's
doesn't
a
look
leg.
like
That's
that.
a leg
I don't
ulcer,
know.
bro, from sickle
What?
cell anemia. That's a
I
leg
can't hear
ulcer.
Nita
That look
Yes,
like
either.
that
something
is
from
a leg
Thriller.
ulcer.
What
He
is
look like he
that?
Yes,
was back
that
in
is a
the
leg ulcer.
bed.
I can't hear
Oh my
nobody. Can
Yes.
God.
y'all hear that?
Yeah, I can. We can hear you, Lucy. So I wanted to touch a little bit on the signs and
Nah, I'm
symptoms.
trying to
Okay,
get a
so
broadcast signal.
and then, bro, I'm gonna pass it to you, James, because I wanted you to touch on what the men go through. Like Lucy was saying, it's certain signs and symptoms that females have that men don't have. And so
Gotcha.
after, I kind of go over a little bit of the common ones, I'll give you the floor and you can go over what the men deal with. So one of the ones that we deal with, the signs and symptoms, is fatigue. No matter what I do, I can stay in bed all day and I still be tired. I'm continuously tired, like drained, like I've just been in the sun all day long working on a house. Another sign is a lot of us have heart issues. I have a heart murmur. So anytime I'm in a sickle
I have
cell
one
crisis,
too.
yeah, you can hear that murmur of my heart. Another one is we have issues with our gallbladder. We have gallstones. I had to have my gallbladder taken out when I was 10 years old. I had severe gallstones the size of a golf ball at that age as well. We have issues with our eyes. And Shay, I wanted you to touch on that in a little bit, but I'm gonna let James go first. But some of us have issues with our eyes. Some of us dehydration, jaundice eyes. If y'all see a lot of days, our eyes is yellow. We deal with jaundice. And so those are some of the signs, and pain is a huge factor, and so a huge symptom of it is pain. And so, James, bro, I'm gonna pass it to you and let you talk about what some of the men go through. Tony, I'm gonna allow you to introduce yourself after James, and then you can talk a little bit about some of the stuff you've dealt with, and then I'm gonna pass it back to Shay.
Can y'all hear me? Did y'all hear me or was I going out?
You went out. You went out
Yeah,
twice, but
You
you're
went
good now.
out.
Okay.
So one of the things that men go through that women don't go through is something called priapism. That's basically when the penis gets hard and it cannot go back down because basically he had a crisis in his penis and it's now clotted in there. So what happens is it starts to get extremely painful. It starts to get swollen and discolored. Now, if you don't catch in time, what happens is you end up with erectile dysfunction and you pretty much, it doesn't work no more at all because the blood now, it can't flow. It killed the muscle. So now you pretty much have necrosis in your penis. That's pretty much what it is now. So what they have to do is take a needle, a long needle, and put it in the shaft and then drain the blood out because it clotted. It can't go back down, so it's stuck. So they have to drain it out. And in worst cases, they have to sit there and do surgery. And that's when it's like too late. They do surgery to sit there and basically it's like almost like a pump. You press a button and it makes it go up again. So that's something that men go through that women don't. Another thing we go through is loss of muscle. Men are more muscle than women. So we go through loss of muscle. So a lot of us are skinny. We can't sit there and keep the weight on because our body's already working overtime just to live, just to survive. Our body's working overtime. Every breath that I take, it's literally 4 times more tiring than what you take. So that's another reason why we're so small. That's another reason why a lot of our hearts are enlarged because it's working overtime just to pump the little bit of blood that we get. So that's a little look into what the men go through, on that side. But everything else is pretty much the same. Like we all go through the fatigue, we go through the being tired all the time, the yellow eyes. That's all the same. That's pretty much all the same. I think Benita is muted.
I can't hear her.
Yeah, I can't hear it either.
No, I had my camera.
Sorry, y'all. I was saying delayed growth. A lot of us go through delayed growth. Like I can remember being in ninth grade and was literally only like 5 feet, 120 pounds. So a lot of us go through delayed growth where we don't grow at a normal rate that normal kids would grow at. Thank God I wasn't a midget. That would have been horrible. But yeah, we got that. And so Tony, I'm gonna pass it to you, and then I'm gonna introduce my sister, and then let her introduce herself because she has a master's degree, and I wanted her to talk a little bit about the psychological effects that people with chronic illnesses face. So go ahead, Tony.
I think Tony frozen.
You got to unmute yourself.
I think he froze. Okay, so we're gonna come back to Tony. Okay, so everybody, this is my sister. I call her Prinky. Her real name is Priscilla. She has a master's degree in
Wait, you said Freaky?
psychology, right, sis?
No.
Frankie.
Oh.
I call her Prinky.
That's so damn freaky.
Not me, James.
My bad. I'm not in the gutter. My bad.
Yeah, about to go on. Can y'all hear me?
Yeah.
Yes.
Can me, sis?
Yeah, I can hear you. Let me turn my mic. Struggling here. Okay, guys. So listen, I'll keep it brief and quick. Kind of just hit on a few points. Most of the time, anybody suffering with debilitating disease like sickle cell, high blood pressure, cancer, things like that. There's psychological component attached to that news. Nobody woke up thinking like, okay, I want to be sick. I want to be, having to take pills all my life and things like that. So there's a psychological component that comes with, any kind of diagnosis. Mainly depression, isolation, anxiety, bipolar. There's a lot of mental health disorders that come along with any kind of diagnosis. I would say for the most part, 85% of the people are going to be depressed. So it's important to have a good support system. I love this kind of group setting where you can kind of talk and vent with people, like you, like minds, get ideas, each one teach one. I think for the most part, with depression, talk to your primary doctor about it. There's nothing wrong. And I know there's a stigma in the Black community about taking medicines for depression or any kind of mental illness. I am a strong component of med management, whether it's psych meds,
Oh my
pain
God,
meds.
yo, this shit's getting me.
Get what you need to get through the day, I would honestly say having groups like this can actually, improve your health exponentially. Just being able to talk to somebody about it, and having just phone numbers, avenues like this. Um, Antidepressants, hey, we all need them in this day and age. I'll be the first to say I was diagnosed with COVID. Thought I was gonna flip out, like, oh my God, these people dying with that stuff around here. It didn't kill me. It didn't kill me. It did kind of like knock the jar me a little bit, but hey, I was doing what I needed to do, staying in touch with my doctor and stuff like that. I don't have sickle cell, I have the trait. And I'll tell you that even watching those pictures of that baby with the swollen hands and feet, I am 50 years old. My hands and feet swell like that now. If I tell my doctor, oh, I got the trait of sickle cell, they minimize it. Like, oh, well, yeah, but it's not the disease. So, you're going to be fine. But I experience pain too. I get cramps in my legs too that last for days at a time and stuff like that. So I know that, this is really about the disease, but as a person that has the trait, yeah, there's symptoms too, right along with what, Bonita showed
Mhm.
those slides. So, um, again, I keep drinking like a lot of fluids, got a big old glass of water right there, take my vitamins, just try and keep myself hydrated and keep my immune system up. That's all you can really do. Lower your stress. I'm not gonna tell you to get out there in the heat and run and stuff like that. Whatever you can do as far as what you consider exercise, do it. Try and do it 30 minutes a day. Not 30 minutes at one time. If you can do it, you can do 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes in the evening. And definitely drink, drink, drink. Psychologically, support groups are gonna be your best friend. That's the best avenue to take. Um, Now the stigma with what these doctors are doing and saying and the treatment, there's nothing like we can do about that except for keep pushing. You just got to keep showing up. You just got to keep showing up. Well, somebody gonna help you at some point. The young lady that was speaking, I guess she was that Shay is her name. The one, I guess she's a nurse. She said she wrote a paper or a dissertation, I believe. I wrote a paper too on health disparities in the Black community and found the same studies that she found. Specifically, there was a study done in Chicago where those doctors said blatantly, we don't prescribe Black people pain medicine. We don't. We never have. That's just not our protocol. If they come in there, whether it's pain, it could be cancer. They don't care. Gunshot wound, we're not giving them anything for pain. Um, not a script to go home with. Now they'll give you pain medicine while you're in the hospital, but once you leave there, you're on your own. Tylenol, Motrin is what they're going to tell you to take. So that study that she's talking about, these are renowned doctors that are saying that they just don't prescribe pain meds to Black people. So now with that, I would say, Bonita, you're pretty active. Write these medicine boards and stuff like that. Like, go all the way to the top. Write your congressman. All your tax dollars and stuff. Yeah, we paying for this stuff, this health care. We are paying for it, and it's not right for us to be discounted or dismissed. Our pain is treated like it's a scrape. So, um, and doctors know hands down that once you get a diagnosis with sickle cell, you're going to be depressed. It's almost like you might as well give them some antidepressant because you're going to need it. You're going to smoke some weed or smoke something to get rid of
Exactly.
that, because you're going to feel like I'm different. Why I had to get it, my sister didn't get it, or, like my level of life, my quality of life might
Yeah.
not be that of another person. So you're going to find yourself comparing yourself to other people. I would always say, it's the clinician in me. Get counseling, get counseling, get counseling, because you need it. Like, honestly, and sometimes that's just what you need, is to tell somebody how your day been. If it's been stressful, that hospital visit, the assholes that work at the hospital. These people are jerks. I mean, I ain't trying to be funny, but they ain't in it for what they used to be in it for. You
At
know,
all.
Oh,
it,
that is
it's
Yeah.
a fact.
changed. It's a
At
whole
all.
So
ball
I
game now.
got a question.
Sure.
I got a question. Okay, so it's a stigma in the African American community about Black people not wanting to receive counseling. Have you witnessed this, sis? And if so, like, why is it that most Black people think negatively about receiving counseling or getting put on medications? Because I can remember even with deaths, just recent deaths, I was okay with going to counseling, but when it came to them wanting to prescribe actual medications for it, I just did not think that that was like the best fit for me. And so I was asking, like, why is it that, you know, in our community, being that we are primarily the ones that get diagnosed with sickle cell anemia disease, why do we give clinicians such a hard time about being put on medications, counseling? Like, what are the reasons? Because it clearly works in some people, and some people they be like, hey, I like counseling, like me, I'm okay with the counseling, I'm just not okay with the medication.
Right. And some of the medications, I'll tell you, with all psych meds, it's trial and error. They have to keep trying you on a different antidepressant until they get the one that fits you with the least side effects. But they don't have a one size fits all. You know, you got the Prozac. I mean, it's a gamut of antidepressants. So what works for you may not work for your friend. But I'll tell you this: if you have a cousin or a sister that takes a specific antidepressant or psych med, most likely it's going to work for you because it's based on your genealogy. Like sickle cell is hereditary. If Prozac worked for your mom or your sister, it'll most likely work for you. So now, as far as the stigma, it's just so new. And after the Tuskegee experiment, Black people just don't trust doctors, no kind, no way. And with counseling and psychology, they went to the church for years. Everybody went to your pastor for counseling. You know, you got your marriage counseling. If you're having problems in your marriage or with your kids, you go to your pastor and talk to him about it. And I don't negate that pastor can give you some good advice, but I just say now you have a lot of Blacks that are getting into the mental health field that can really, you know, help you with your situation because they done been through it, you know. So you just have to give it a chance because it's still new for you to see a lot, you know, Black faces, brown faces in counseling. It wasn't like that before. It was the white lady, the white man, you know, sitting on the couch. It's not even that anymore. And so we just have so many people that don't look like us. So that's why everybody went to their pastor for counseling help, mental health counseling, you know. So did that answer your question?
Gotcha.
I just want to add on to what you said.
Yeah. Anybody got any questions? Oh, go ahead, bro.
There's a good reason why we don't sit there and go to therapy for stuff. You got to think about this. When we're younger, what is one of the key things we're taught when we go to schools like that? Do not talk about what goes on in this house. What goes on in this house stays in this house. So what happens? We grow up trying to figure out for ourselves, knowing we're not supposed to talk to outsiders because there can be a taboo or consequence behind it. So when we grow up, we're like, oh no, we can't talk to nobody about this because what goes on in this house stays in this house. So it's been generation to generation of that same thing, and we're just breaking out of it. So I think that's another piece to it, you know, like that's another piece to that puzzle.
Anybody got anything else they want to add? Because I'm gonna let Tony introduce himself and talk a little bit about what it is that, you know, he goes through, and then we're gonna pass it back to Shay. Can you hear me, bro? Tony, can you hear me? I don't think.
Yeah, what happened?
I'll be right back, y'all.
Okay. I was gonna allow you to introduce yourself to everybody and talk a little bit about what you've experienced.
As far as what?
As far as having sickle cell, discrimination, the need for better health care, whatever you want to say, bro.
I mean, discrimination. I don't really, you know what I'm saying? I know people like different parts of the country, you know what I'm saying? And they probably go than in New York hospital for over 15 years. So it's like I'm well known where I'm at. Not really that much discrimination, but it's sometimes it's hard, like, because you deal with different doctors, you know what I'm saying? Not every doctor is the same, you know what I'm saying? And not every doctor, I guess, views you the same or looks at you the same, you know what I'm saying? So it's as far as like receiving pain medication or like receiving. So I try to do the same doctors that but I know, like, lately, like when it's a new doctor, you know what I'm saying? It's difficult. It's I should say difficult, but it's harder to, you know what I'm saying, explain yourself, and it's hard. Like right now, they got a new policy. You know what I'm saying? I don't know what's going on in all parts of the country, but in New York, they got a new policy where the procedure in the ER has changed. So give you as much pain
What is
medication
the
in
new
the ER,
procedure in
or they
the?
don't.
What's the new
They can switch it
procedure?
up. So now it's kind of like pill form.
Really?
It's what I didn't. He was breaking up. It's what?
He breaking up,
Yeah.
bro? You there? Because he broke. He started
I don't know.
breaking up
Everything
at
is
the good
limited
part.
now. You know what I'm saying?
Right. I didn't hear it.
Really? So they switched it up to pill form.
More on what you say. Now it's like it's.
He keep breaking up. Can you
I
hear me,
know.
bro?
I'm like, I can't hear
I'm
him.
trying to hear what he's saying because New York, from my understanding,
I
they
think
have
that
really good health care for
brother
They're
New
too
York.
is
really good
epidemic,
hospitals
man.
and
How you doing, man?
really good state to
What's
go to
good, man?
ER. So yeah,
Can you hear me, Tony? I think he froze again.
his Wi-Fi is like,
Yeah, I think his Wi-Fi is messing up. Okay, so um we touched on the complications of sickle cell. We talked about the psychological effects and the need for counseling or medications due to depression, anxiety. My sister touched on that. um, so did we explain what a sickle cell crisis was? Didn't you
yeah.
explain that, Lucy?
Yeah, we did. Can I say something
Yeah,
about
go ahead.
depression though, real quick?
Yeah, go
Before we
ahead.
move on, I just wanted to say, when your sister was talking about the depression and what it can do to you, also, depression for a sickle cell patient can force you to stay in the emergency room because you'll get in your
True.
mind so much about it. You feel alone, and you any little bit of pain that you have, you'll be like, "I'm going to the hospital. I'm going to the
Oh
hospital.
man.
I'm going to the hospital. I'm going to the hospital." And that is a big sign of depression. And I feel like we've all been through that. I know I did. I went through it in my early 20s. I had pain medicine at home, but I felt like I didn't have a lot going on in my life. I felt like I was always sick. And, my answer was the emergency room. It could be a pain crisis in my little toe. I'm going. I wasn't giving anything a chance to work at home. And so that is a big sign, and it's something that you have to work through. It is. It is. It's something that you really have to work through and say, like, I don't want that for myself anymore. I don't want to live in the emergency room. So I just wanted to say that can happen also.
I want to piggyback off of that. You right. I think that a lot of us, everybody isn't fortunate enough to have a support system, a good support system. And so I kind of think that um that is true. And in a sense that some of them overuse it, which affects us negatively. Because all it takes is for a doctor to run into a handful of warriors who are, addicted or who are abusing the fact that they have sickle cell anemia disease. And, that could change his whole perspective of us as a whole. And I think that this is why there is a need for change, better hospital protocols, implementing, new procedures about how they handle us, because it's crazy that in 2020, you can still run into doctors who don't know anything about sickle cell, don't know how to treat it. I had a doctor that had to contact my hematologist to tell him what to do. And, I thought that was kind of, weird, because I'm like, it's 2020, like, who don't know about sickle cell? But actually, they don't spend a whole lot of time on sickle cell when they're in medical school. And so you combine that with some of the warriors abusing the system, and this is what you get. This is the outcome. But I also feel like we have a chronic illness where we have a need for narcotic medication. There is no way that a Motrin is going to even begin to touch the pain that we experience when we are sick. And so the opioid crisis, and that's what I wanted to touch on next. We should not have, we weren't supposed to be excluded from those laws, period. Like, we were never even supposed to be included the laws that were supposed to take down the opioid crisis. But I think that being that this is a piece of color, and we do have disparities in our healthcare system against African Americans, I think that we just automatically got through into there. And so, Shay, what are some of your thoughts? And what have you seen as a nurse, like working as a nurse in the healthcare field, regarding like how medical professionals view sickle cell warriors or Black people in general versus, other races?
I think that one of the biggest things that I have seen as a clinician, and I see that there's another clinician in the chat room, that, as was mentioned before, there's not enough education around sickle cell. However, there is a lot of education around the opioid crisis that has been happening, and we are collateral damage, if you will, as a result of the opioid crisis. What I have encountered both as a patient and as a clinician is that many doctors and nurses come in with their preconceived notions about what sickle cell is, what sickle cell warriors feel, how we are just drug seeking, and so on. I've always go back to the story that Courtney told probably about a year ago or so, about how she went to the emergency room and the doctor refused to treat her, or he treated her badly. And it wasn't until he experienced it through his husband or boyfriend, whatever the case may be, because of an injury that he received, and he needed narcotic medication, and the hard time that they were giving him. So he now understood about Courtney's plight, or our plight as sickle cell warriors, trying to seek medical care, but being prejudged or not being able to receive the care that we need based on somebody else's preconceived notion. As a nurse, I have been the person to educate people, not only on sickle cell, but on the side effects of sickle cell crises, and even the side effects of medications. With the hydroxyurea, which I have been on since 1998, There's a high incidence of some of us developing lymphomas. Some of us, I have developed this skin disorder as a result of taking the hydroxyurea for so long. And I'm finally seeing a dermatologist who actually understands what is happening. Um, Hydroxyurea is for people with metastatic head and neck cancer or metastatic ovarian cancer. And for those of us who are taking that medication, we're opening up ourselves to being diagnosed with other forms of cancer because it is a chemotherapy agent. It reduces your immunity. And when you reduce your immunity, you know that you're open to a lot of things. So I find myself as a nurse educating my colleagues, educating patients, even educating doctors with regards to sickle cell, with regards to what we endure. I've even sat on a panel, if you will, at Mount Sinai Hospital in Manhattan, here in New York, where I had a nurse call me a frequent flyer and a shifter.
Wow.
Now, so like my port, after I had my port inserted, there was an issue with it and one of the strings popped. And so it shifts sometimes when you try to access the port. And so this was my first time when I started attending Mount Sinai. And she was like, "Oh, we've got a shifter, we've got a shifter." And I felt very triggered by that because we have been called so many names before. So there's the drug seeking, there's the frequent flyer and everything like that. So when you hear those things, you are triggered by name calling. And so I made sure I reported that and I was able to sit on a panel to explain to fellow nurses that, listen, when you label a patient as something, you are reducing their self-esteem. They already have issues of people looking at them differently
Chase me down and
because
shit.
of the disease
Can't go
process.
ahead. You
Now you're
can't.
adding
Man,
a
what the fuck is
different
a
name
hospital, yo?
to what we already have. So it's important for us to empower ourselves, but also to take the time to educate. Don't be afraid to educate people about our process, about our disease process, about what we go through, about what we experience, because unfortunately, they don't have a clue. It's not taught. I can remember when I was in nursing school, we didn't learn much about sickle cell disease, and I had to educate my professor on sickle cell disease because it's something that is glossed over, where they will spend time on leukemia, where they will spend time on other disease processes that really affect the Caucasian community. Very, very, very little time is spent on our disease process. So, as a nurse, I've had to educate. As a patient, I've had to educate. And I think that sometimes we just get so tired of it that we feel like we should be in the classroom teaching because what are you learning? And just like you mentioned, Ms. Bonita, that you had a doctor who had to call your hematologist to figure out what's happening. There's some hematologists that don't care about sickle cell. They only care about other blood disorders. One of my doctors that I had before at Methodist Hospital, he could care less about the sickle cell, but he was very proactive with his cancer patients. So, different providers bring different things. And unfortunately, we have to be the ones to be the advocates for ourselves and to educate as much as possible. I hope I answered your question.
Yeah, you did a great job, and I definitely agree with everything that you said. A lot of them don't know, and if they don't know, I had to go 2 hours outside of where I live to find a hematologist because no other doctors. There are hematologists and oncologists here, but a lot of them would not take me on as a patient. Why? I think it's because our care can get so complicated. A lot of them, they just don't want to deal with it, or us, or they think of us as non-compliant, or like a problem patients. And so I thought it was really sad that the area that I live in, no doctors would take on sickle cell patients. So I had to actually travel 2 hours just about outside of where I stay at to find a good hematologist. And I thought, like, it spoke volumes to me, like that spoke volumes to me, because it's like, you the blatant, like, they're so bold with it, like, and comfortable with it, like, to the point where it almost infuriates me that they wouldn't, that it wouldn't be no discretion or no compassion on their part, because a lot of them are of Asian or African or Latin descent. And so it's just really sad when, you do find doctors like that, where for sure that they potentially either have somebody in their family or somebody close to them with sickle cell, and yet they turn a blind eye or mistreat us. Like, it's really sad to me. That's really, really sad to me. And so,
you have to be careful with them
you got
also.
anything to add?
Yeah, I was gonna say, they listen to all the sickle cell patients, that are watching and everything. When it comes to finding a good doctor, it's not going to always happen overnight. And you have to be careful, because you have those doctors out there who would like to experiment on you. They're going to act like they're scared, but but they're going to experiment on you. And they're doing that because either they're getting a kickback, I've been through it, or they just want to see what they can use and see. And sometimes they do it just to see if it's going to work on the cancer patients. You know what I'm saying? It's a lot of reasons that they can do it, but it's not going to always happen overnight. And I always find out that when I'm advocating for, other warriors, and they say, oh, I can't find a hematologist. Oh, my hematologist is doing this and that. It's like I said, it's not going to happen overnight, because there's so few that understand. But when you do get a hematologist, you want a hematologist who's going to fight for you. You want a hematologist that's going to be on your team. You want a hematologist who's going to give a fuck. I mean, care, basically. Because if you don't have that, your care is not going to be where it should be. And you're always going to be in a fight. And we already fight enough. You get what I'm saying? We already fight enough. And it's sad that when we go to the hospital for care, we already fighting with our body to deal with this pain, but then we got to go fight with a nurse or a doctor in the emergency room of the hospital when you're trying to get care. And that's not fair. I mean, Shay touched on this story that I told, and that's awesome that y'all listen to me and y'all keep that type of stuff with y'all. I'm glad y'all do, because that's awesome that she remembered that. But um I was getting treated at this particular hospital that I actually, the care there now, it's a lot better, but I still will never go to the hospital. I'm not going. But I was getting treated there, and there's this doctor there, right? And I forgot his name, but he was gay. He was short. He wore these glasses. He was a little pudgy. But every time I saw this doctor in the emergency room, I'm like, oh God, I'm not going to get treated right. And we all have this experience. We know we've been to a certain hospital, and this is a particular hospital that our doctor wants us to go to. And it's always that one doctor that does not want to comply, even if you have a pain protocol. And let me just explain what that is to people who don't know. A pain protocol is when you go into the emergency room and your actual hematologist has set a pain regimen for you, to where the ER doctor doesn't have to just figure it out himself. He can look at what your doctor put in and start your medications. So basically, with me, if I was to go into the emergency room right now, they would know, oh, okay, depending on her pain, if she wants to start off in a pill form or IV form. If she wants to start off in IV form, her doctor is instructing her to get IV fluids. She can't get IV fluids and the pain is too bad. Her doctor is instructing us to go ahead and give her IM shot, and then they'll put the milligram and how, the milligram, whether it's Dilaudid, morphine, or whatever, and how often you should get it. Okay, that's basically what a pain protocol is. So we all have that one doctor when we go into the emergency room and we see that particular doctor and we're like, fuck, like it's going to be a hard night. It's going to be a long night. It's either been times where I even thought about, damn, should I leave and go to another hospital? Is the doctor going to treat me fair? And some of us don't have the luxury to get up and leave and go to another hospital.
Mm-mm.
So we have to sit. Can y'all hear me? Because I got a call. Can y'all hear me? Can y'all hear
Yeah.
Yes,
me?
we can hear you.
Yeah.
Can y'all hear me?
Yes.
Yeah.
We can
Yes
hear
or
you.
no?
We can
Yes.
hear you.
Yes.
Y'all can hear me? Okay.
Yes.
So
Yes.
okay, so we have to deal with the bullshit, right? And so basically what happened is I saw this doctor. Every time I saw him, I knew it was going to be something, it's going to be a problem. Every time, and I had a pain protocol, and he refused to follow it. He refused to follow it. It was always, Miss Dickens, you're here again. Oh, well, listen, I'm not going to follow your pain protocol. That's too much medication. I don't agree. And my thing is, why is it up to you what you get to do for my pain when my doctor is specifically telling you this works for her pain? You know what I mean? But they get so judgmental and they want to do what they want to do. You get what I'm saying?
Mm-hmm.
For your pain. So he's always, I'm only going to give you 1 milligram of this, and I'm only going to do that, and stuff that is not going to touch your pain. Like, it's a waste of time. I could have stayed at home. You know what I mean? If that was the case, I could have fought it out with my pain medication at home. So he gave me a hard time each time. I want to say consistently for a year and a half. Right. So finally, I stopped going to this particular hospital, and I ended up out of town. Well, not out of town, but like I was at my auntie's house. She lived like 15 minutes away in another city, and I go to this hospital. It's called John Maris in Quick, okay? And so I go to this hospital, and the I see him, and he sees me, this doctor, and I'm like, what the fuck is he doing here? Like, you know what I mean? Because he's supposed to work at that other hospital. Like, what is he doing here? But they switch around sometimes. But I'm like, this is kind of far for him. So I just ignore him. But when he sees me, his face literally gets red, like he's blushing, like he's like flustered, and I'm like in a lot of pain. You know what I mean? So I'm just like, I don't care if I have to get the 1 milligram. I just need this to go away. I'm hoping that there's another ER doctor here that will, take my case. But even sometimes when that happens, you have that one doctor that whispers in that ER doctor's ear.
Yeah.
You know what I mean?
Yep.
Like, look, she's always here, or she has this problem and she just wants this. And then it persuades that ER doctor to treat you
Yep.
shitty. You get what I'm saying?
Yep.
So I'm just hoping and praying, like, okay, hopefully this doctor has a mind of their own, and you know what I mean, they're gonna follow my protocol and it's no problem, because this guy gives me an issue every time. So as soon as I got in the room, usually at the other hospital, he would take his sweet time getting in there. Soon as I got in the room, laid down, got my gown on, and I don't really put on the gowns, but this particular time I did. But he came right in. He came right in, and I'm like this. Here we go. Like, I'm just like, here we go. And he goes, I deserve that. And I looked at him like, what? He goes, I deserve that. Your face expression, I deserve that. He was like, because I want to come in here. He was like, can I talk to you personally? And I'm like, yeah. And I'm like, we all have this thing when we're in a lot of pain. We get to rocking or rubbing our
Mm-hmm.
feet, or, we can't stay still. So I'm
Right.
in this pain. And he says, I see that you're in a lot of pain. I know what you want. I know what works for you. I'm going to follow your protocol. I already have the nurses getting it. So I'm like, what the fuck is going on? He never does that, right? Ever. It's always something, point 0.5 or this or that. It's always something minute and small. So he says to me, I need to apologize to you because I treated you poorly for a year and a half. And he starts getting very emotional, and he's getting like he's about to cry. Takes his glasses off, he's wiping his face. He said, my partner, he's like I told you he's gay. So he said my partner, my husband, was in a very bad accident, and he's in nothing but pain now, all the time. Whatever happened caused him to have all of this pain all the time. And I'm a physician, and I can't even do anything to help his pain. And so now, at first, we weren't having issues with getting him proper pain medication, but now he has to go to the emergency room some nights because it gets bad, and they won't treat him. They won't give him the proper pain medication. They won't do anything for him, and then I have to come as a physician and advocate for him, and it doesn't matter what my title is. Sometimes they just won't do it. And he said, and it just reminded me of how I treated you for a year. And it was sometimes you came in there and you told me how bad your pain was, and I didn't believe you. And that man broke down in tears. He broke down in tears. He apologized to me. He said, I will never treat another patient like that again. You set the standard. He said it was plenty of times, if I were you, I would have cussed myself out. But you didn't. You were frustrated. You left, but you didn't. And he said, and so now every time you come to this particular hospital or any hospital that I'm working at, and I see you in the emergency room, and I see your name in the computer, they're going to bring you right back, and you're going to get your medication immediately. And the nurse walked in, they started my IV, and they medicated me. And he said, if it's not enough, let me know, and she'll come back in and give you more. But he said, but it shouldn't. He said it shouldn't have took me to go through this with my significant other to treat people with chronic pain, illnesses, or whatever kind of pain, to treat them right as a physician. And so that's why we always say, you know what? When they treat us like that, we're always like, if your family member was in this kind of pain, you wouldn't act like that. Or if you felt this kind of pain, you wouldn't be saying that. You know what I mean? You would be wanting this Dilaudid or this morphine or whatever it is. Or when they say you're drug seeking. Yes, I am drug seeking. You know why? This shit hurts. So yes, I am definitely drug seeking. You know what I mean? If that's what you want to call it. Because it's not an easy pain to put up with, to deal with. Especially when we know there's levels to this shit. You get what I'm saying? There's levels to this pain. And when you get to that top tier level where it is just unbearable, the last thing you want to do is deal with a doctor who is not going to treat you properly. It's just unfair, and it's a lot of reasons why we're not getting believed, and then we're passing away. They don't believe you. You know what I mean? And you're in that amount of pain. They don't believe you, and then you have a heart attack, and they don't. Oh, we should have believed that person. You know what I mean? It's unfortunate.
Yeah. And I think that a lot of people are passing away because of the lack of medical care, and a lot of the stuff they could have found. Look at how much some of them are at the hospital and nothing is ever found until after they pass and they do an autopsy. Like, why should it take for so many warriors to die before they actually try to figure out what's going on? Like, I get it. And we all know the complications of sickle cell, but I do believe that a lot of the deaths were preventable. I really do. I think that maybe if the care was better and they actually looked into everything instead of just passing it off as, oh, well, they're just going through a crisis. Oh, well, chest pain is normal, because it's a part of sickle cell. Like, I believe that maybe a lot of people, would have had better outcomes versus death. But I definitely believe a lot of those deaths were preventable. Now, I don't know for sure, because it's always this hush-hush thing in our community when warriors do pass. But I do think that it has something to do with the lack of good quality medical care.
I wanted to
And
touch
so,
on something.
go ahead, James.
Trina, you want to say something first?
I was just
Yeah,
gonna
you
say
wanted
real
to
quick,
say something?
yeah, because when my sister, she has sickle cell, and when she was sick a lot more than I was. And when she was in the hospital, she would go in there and they would always just want to give her the pain medicine. And she's like, no, it's not. Something is wrong. And the hospital that we normally go to would not listen. They just wanted to give her the pain medicine and send her home. And then she went to another hospital and found out that she needed to get a hysterectomy. They tried to say all that was sickle cell pain, but it was a whole nother issue.
All right.
So they use that excuse when they really don't want to deal with it. They don't want to do the work. They just use that excuse. Okay, well, they're just having a crisis. Just give them some pain medicine and then send them on their way.
Put a
And they
band-aid
cover
over
that
it.
up. And a lot of people don't really think about the other half of what the hell? The outside. Oh shit! What's that?
Mm-mm.
Hold on. Oh my god! Why'd you do that? I'm sorry, y'all.
You real ghetto, sis, right?
She like, oh my God, girl, I thought somebody was about to try to rob you or something. I'm like, what the hell she got going on over there?
But they don't think about the other side of it. Like it could be something more serious going on. They don't want to do any other work. They just want to give you that medication and push you out the door. When there's deeper
Yes.
issues and it's never found until it's too late. Thank God she pressed and said, no, I'm not going to settle for this. And went to another
Yeah, you have
hospital
to tough it.
and they did what they needed to do and found out what was going on.
Exactly. Bro, you got something to add?
Yeah, it was about the experimentation side. A lot of warriors,
Oh, go ahead.
we got to start speaking up for ourselves because
Mm-hmm.
we start accepting because we want them to sit there and say, see, look, they're working with us. Look, they're not the bad one. Look, we'll try this, we'll try that. And you
Mm-hmm.
know it's not going to work, or you don't even know what the hell it is. Like,
Yep.
I'll give you an
Exactly.
example. When I was 18, 19 years old, we sat there and my mom put me in a pain clinic because I was like really bad off. And they experimented on us. They sat there and gave us something called Actique. Actique is literally a fentanyl lollipop. It's like it's
Mm,
like you put it in your mouth, you twirl it, fentanyl goes straight into your system, like fast.
Yeah, I heard about
And
that.
wow.
at first they was giving it to cancer patients, but they wanted to see what would happen if you could take it long term. So they're like, okay, let's use it on sickle cell patients and see what happens. Now, I'm not gonna
Wow.
lie, it did help with the pain, but they didn't do it for the pain. They wanted to see what the side effects was gonna be. It was so real
Mm,
that the person, they had a spokesperson for that company going there and watching us and taking notes. A lot of us lost our teeth because of that. Our
wow.
teeth started like our teeth would literally rot from the inside out. By the time we found out anything was
Yeah.
wrong, most of the teeth were hollow. So there's a
Mm.
lot of people that lost their teeth. Like, the one that came that was not enough,
Yes.
her
Yes.
teeth were, the teeth were missing because of that. I got off early. They
Wow.
kept it going.
So what did they
So
tell y'all it was for? They just said it was for sickle cell anemia disease?
they said it was for pain. They was like, "Oh, this is for pain. Like this will work for you. This for pain." So we took it,
What?
and not knowing that they was testing on us. So literally, when I saw people teeth falling out, I sat there and I stopped, but other people kept going, and they ended up like with no teeth. Yeah, spokesperson, she started crying, saying, "Oh, I didn't know this was going to happen. I'm so sorry." We never seen her again. 2 years later, there's a lawsuit, a class action lawsuit about those lollipops because everybody's teeth was starting to go missing, and they changed the formula because of us. So, like sickle
What?
cell warriors, y'all
Did,
gotta sit there
did
and
y'all
y'all
have
gotta
to
speak up for
sign a
yourself.
waiver?
We
Did y'all
we
have to
signed
sign a
something.
waiver?
We signed something when we first went in. Yeah.
Wow, that was smart. Now that was underhanded. So what if y'all would have died from it or something like deadly would have happened? Like your family wouldn't even been able to sue. Like that was underhanded. That was very
Yeah.
underhanded.
So
That's
that's
what
why
happened
ever
with me
since
with
then.
the pain pump. Remember, Nita, I had a doctor who wanted to put the pain pump in me, and that almost fucking killed me. And it's basically like what James said. You do it because you want your doctor to be like, look, I'm working with you. You know what I mean? Like, even though in my head I'm like, I don't want to do this. I
Right.
don't
Right.
want to do this. You get what I'm saying? But you don't want to be like that patient and be like, oh, I'm just not going to, comply with my doctor. And that taught me a big lesson about listening to your body, listening to yourself, because you know what's best for your body. Like with me, I just won't allow anything in me anymore.
Look at what they're doing with
Nothing.
ketamine now. They're
Nothing.
giving warriors ketamine.
Yeah, and that shit, I heard that shit makes you hallucinate and stuff. But with that,
Yeah, they said if you hallucinate really bad, I know I won't be taking it.
I
That's
won't
what they
either.
tried
Absolutely.
to give me. That's what they tried to give me on the surgery table. Ketamine.
What?
They tried to give me ketamine. I told them no, I will not take it. They looked at me so stunned. They're like, "But this is gonna help." I'm like, "No, I won't take it.
I don't want
You gotta do
nothing that
something
I'm
else."
not used to. Like, listen
Yeah,
to
I'm
your
not doing it.
body, listen to your first mind. Do
So
not
you
do it because,
gotta
like I
stand
said,
up for yourself.
yeah,
You gotta
that
stand
taught
up.
me a big lesson. That shit, I had to have 3 surgeries after that, back to back
I
to
remember
back.
that.
And I was so weak. I was in so much pain when they had to give me pain medicine. It was like it went from every 10 minutes to every 5.
Wow.
The doctor was like, I cannot believe I've never heard anybody like screaming and howling in this much pain before. Like, this is crazy. And it was so bad that the surgeon who put it in, this is how I knew it was some sneaky, grimy shit going on. The surgeon that put it in came in after they removed it. I had to get a wound kit care and all this stuff. Like, he came in, he said, Miss Dickens, if they come to you after you go home and you go back to the clinic and everything, if they come to you and tell you to get this again, to try it again, say no. This is what the surgeon
Yes,
told
Lord.
me. He said, because I've never seen it. Uh,
You know,
what is the word I'm looking for? He said, I've never seen it like somebody's body rejected so quick. Okay, he said, I've never seen that before. Your body rejected it within 2 to 3 days. My body just knows, like, don't fuck with me. I'm
What
going.
was
You know
it?
what I mean?
What was
Huh?
it? What
I
was
had
it?
I had a pain up inserted in me, and so basically, what that is
Oh, I'm
to
just
people who
talking
don't
about.
know, so this is a pain pill.
is it just low for me? She's really
Yeah, she
low.
went low.
Can
Yeah,
y'all
you went
hear
low.
me?
There you go. There you go.
Oh, sorry, my hand was probably covering it. Okay, so it was a pain pump, right?
Mm,
They put it on the side of your stomach, and I had to have surgery. This is a way for them to say, we don't want you on pain medicines anymore. You go to the ER or whatever, you might have to get this IV medicine injected in you every so often. So it came with a little remote or whatever, and you press it when you're in a crisis, and it'll give you a jolt of like IV pain medicine, a very small dose though.
right.
They start you off very small so you don't overdose or, you know what I mean, anything like that. And so mine was only in for 2 days and it rejected.
What was the medicine?
Dilaudid.
Oh, it was dilaudid under your
Hmm.
skin.
Yeah, like
Okay.
it was like it's like a little box. They cut it inside of me. They put it in, and it goes around into your spine. So it's not like going in your veins. So that way when you get the medicine, you can feel it instantly. They give
Right.
you a bolus dose a very low bolus dose that stays in your system all day. So you
Right.
don't have any pain. But then if you have stronger pain that comes through, you have the button that you can press and it'll give you a dose of the Dilaudid. All right. And I didn't want to do it. I told them I didn't want to do it. I was uncomfortable with it, but they kept pressing the issue, kept pressing the issue, and I just didn't want to be difficult. And they kept, oh,
Yeah.
this is going to change your life, and da, 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 all these things to make you think that this is a good idea. And so, yeah, it should almost killed me. My body rejected it, and I went septic.
Wow.
And I had to have 3 surgeries after it. Okay, one to have it removed, one to put the wound kit in and have it clean, and then had to have the wound kit removed. And the surgeon came and told me they're going to come and tell you. He told me this in the hospital. They're going to come and tell you to try it again. It rejected to try it again. Do it again. He said if they come and ask you that, even though you went through all of this, they're going to ask you. But he said if they do, tell them no. He
Right.
said, do not do it. I was gonna tell them no regardless, but he, you know what I mean? He put something in my mind and make me feel like, well, damn, what do they got going on? And
Right. Right.
come to find out, the doctor, that hematologist was a very shady hematologist. I found out about other physicians that worked with him who left his practice because of his shady ways. And I ended up with one of those physicians because when I went back and they asked me to do it, I said no. They started trying to blackmail me. Well, we're not going to give you all your pain medicines now. We're not going to give you all your pain pills anymore. If you don't, we're going to keep you on your pain medicine for 2 months so you can get better. But then after that, you need to get this put back in you.
Isn't that crazy how they sit there and try to force you to do something? Like
That
they
is
really will blackmail
crazy.
you.
Mm-hmm.
They really
And I
will.
told them that's absolutely not. I will go look high and low for another doctor. I will go through whatever I have to go through, but I will not put that thing back in me. And I did. Benita tell you, I went through hell trying to
Mm-hmm.
find another doctor. High, searching high and low, was, not getting adequate medication, everything. I was going through it.
Yeah.
Eventually I did find one, but the thing about the one that I found, she was all the way like an hour away. And she was the one that was in his practice. She actually came to me in the hospital and was like, she was very nice. I remember her. She was like, whatever you need, like whatever dose you need, you've been through so much. I'm the doctor on, I'm writing your orders, whatever you want, just ask the nurse and you got it. You know what I mean? And I remember that I wanted her after after they tried to kick me out the practice because I wouldn't put it back in. I wanted to
Yeah.
see her. But they basically blackballed me from seeing anybody else in that practice.
Yup. They do that.
They will do
Yeah,
that. And
and that's
so
just like with the drug Suboxone. I've heard of them misleading sickle cell patients into getting on to Suboxone and not telling them that once you're on Suboxone, you cannot take narcotic pain
Nope.
medications because it will precipitate withdrawals. You'll go into severe withdrawals to where you can possibly die. A lot of them go visit the patients in the hospital and really press the issue about them getting on Suboxone without fully telling them the side effects and what could potentially happen. And I had to tell somebody, I was like, do not, absolutely not, do not take that. I said, because what they're not telling you is that once you're on it, you're on it. You can no longer get Dilaudid. You can no longer take Lortab. You can no longer be prescribed the normal opioids that we need for when we're in severe pain. But that person was just like, they
methadone
never
too.
told me that. They've been coming with me every day. I was like, and
That's
this is
how
why
they.
you
That's
have
how
to
they low
educate
key.
yourself. I was like, because
Mhm.
That's how they
go
low
ahead,
key call
bro.
you a drug seeker. That's how they low key call you a drug seeker. Yep.
Yeah, and the
Yeah,
methadone
yeah,
too.
and that's
I
what
was
I
telling
told
Mia
her
like
too.
my pain medicine is not working anymore. Like I feel like I'm having to take more and more of the Dilaudid. Like what the heck is wrong? And she was like, "Well, are you taking
Yeah,
anything else with it?" And I was like, They're giving me methadone." She was like, "Girl, that's an opiate blocker. You didn't know?" And I would usually take one
girl.
or two pills a day of the Dilaudid. I was going from that to damn near 6 pills a day. Like, what's wrong with me? Like,
Yeah,
it was
she
something
was
wrong with me.
like, bro, she was like, I don't know what's going on, girl. It ain't nothing working. And I'm like, what else are you taking? She was like, well, girl, they got me on this method. I'm like, girl, you do not know that that is an opioid blocker. I was like,
And you
girl,
know,
you better
they
get
do that
off
a
of
lot.
that.
They do
But
that a
they
They
lot.
put me
do.
on that.
They
Yeah,
do.
and I didn't know, and
I
I'm like,
refuse to take it.
yeah, I didn't know, and I'm in the ER. They having to give me more of the Dilaudid. And they're like, "Are you in more pain than usual?" And I'm like, "No, it's just not working." And that's why.
Yeah.
And then I'm like, "You gonna have to get me off of that too. I'm not doing it." You know what I mean? I stopped taking that totally, and then as soon as I stopped taking it and got it out of my system, all the medicine started working again.
That's
Yeah.
ridiculous.
And they
Because they
feel
tried
like
to
the
make
withdrawal from that is ridiculous. But go ahead, sis.
they was trying to get me to take that, and I absolutely refused. I didn't know at the time. I didn't know that it was the opioid blocker. I just thought all I heard was methadone, and I'm like, no, they use that for crack. They need to get off the drugs. I don't want
Hmm.
no part like that stigma just messed my head up, and I could not accept it at that age. Like I'm not going to be doing this, and I just refused. And I'm so grateful that I did because I started hearing all this crazy shit about it, and I'm like, mm-mm. Like, why would you try to do that to someone that you know needs some pain medication? If you know
Hmm.
that that's going to block the medication that's supposed to help
Yeah,
them,
that's
why
great.
would you give
That's
them
when you
something to
have
kind of help
doctors
you?
who
Like that
don't
makes no
care.
sense.
And remember, Nita was like, Google, I could, me and that doctor I could text him, like we had a relationship where I could text him. And I'm like, did you put me on this because it's an
Like,
opiate blocker? He's all trying to tell me it is not an opiate blocker, this, that, and the other. And Nita's sending me articles, from Googling articles and stuff. And I'm texting these articles to him like, so you're gonna keep telling me this is when we have
mhm.
like professional doctors in the government who saying these things. You're gonna say you're gonna keep telling me this, and then finally he was like, "Okay, so do you want to get off of it, or what do you want to do?" I'm like,
He got an attitude.
"Yeah." I'm like, "What the fuck?
I'm gonna tell you though.
No,
Happening?"
So
he
what should have
did
said?
get an
The
attitude.
reason
You
He
remember
had
that? He had a whole attitude when I seen him.
the reason why they sit there and use methadone is because it binds the pain receptor so well. Like it's very good at binding the pain
yes,
receptor.
Yeah,
But they don't tell you all the other side effects. They don't tell
yeah,
you
they
everything
don't.
else. When they took me off of methadone, I ended
they
up in the
don't.
hospital. That's how bad the withdrawal was. It put me in the
Oh my
Hmm.
God.
hospital. Like
I'm
I,
glad I didn't have
I
that. I
never
wish I
want
Somebody
to
didn't
else
have
live
that
said
again.
that
long
too,
ago.
bro. I
It
know.
was bad.
I'll tell you after the live.
Yeah,
Somebody else said that too.
Yeah, it was
I don't think I
bad.
had a
That's
bad
horrible.
withdrawal from it. Luckily, I wasn't on it long enough. I had said something to Nita, and then he caught it. You know what I mean? So it
I was
was
on it over
good.
8 years.
Oh well, that's why.
Yeah.
It
Dang,
was,
8
yeah.
years?
And what
Woo.
happened when you tried to get off? It was bad. What did you go through?
Well, see, the doctor had her head up her ass. She sat there and got mad because I wanted to get off. So she
Okay.
abruptly cut me off and switched me to morphine, which you can't do. It sent me
You
through
can't
such bad withdrawal. I
Hmm.
like literally, I almost died in the hospital. Doctors was calling her. She got written up. They transferred her, and I was telling her I want to see another doctor. She said, if you go to any other doctor in this practice, I'm gonna make sure that nobody talks to you and writes you. So you're gonna have to do it my way. And her way sat there and sent me to
What?
the hospital. Yup. They blackmail you. They really
Is she
do
still
Hmm.
blackmail you.
practicing? Is she still
I don't
practicing?
know what happened to her because the last time I went there, she was in like somewhere else. They wouldn't tell me where she was at. They said she's no longer with this building. I guess that she got in a lot of trouble for that.
Girl, Dr. Chucky has to get up out of there. I forgot to tell you, Nita. He resigned before they fired his ass because he was on his way out. He had got so many
what?
complaints from physicians and patients.
What?
Physicians and patients, yes. And he is no longer working. He
Wow.
has a lot of stuff going on. But yeah, that's crazy that they do that, and they will. And that's why I say you have
And
to
that's
know
crazy that they
your
don't.
body.
Yeah, they don't really be telling people, like the side effects of those drugs is like trial and error. Like I thought that
Hmm.
was crazy as hell that they would be visiting, patients on the hematology floor trying to convince them to start Suboxone. I'm like, girl, do you not know that that is like a opioid antagonist. Like I was like, once you're on that, you cannot take any type of narcotic opioids or else it'll precipitate withdrawals. She had no idea. I was like, and then like you said, bro, I was like, they're low key calling you a drug seeker without calling you a drug seeker. You know?
Without
Like,
calling you one,
it was
by trying to put you on that.
yeah, it was just crazy, like how quick, sometimes we are to try things versus researching and, like educating ourselves about it. Because I've learned to always double check behind, triple check behind them when it comes to these drugs and these medicines, because sometimes they don't have your best interests at heart. They don't.
I'm
Sometimes
not
it's
even
about
gonna lie.
money. And then,
When I didn't like as I got older, I didn't start. I really did not start doing too much research on such medication until I had my daughter and she was diagnosed. Once my daughter was diagnosed, I said, "Pack her abuse as far as I can for her," because I'm not going to allow them just to do it and give her anything just because I need to know more. So that's when I'm honest to God, that's when I started doing my research on all this medication. I wouldn't let them give her any narcotics at all unless they would have to give her Toradol. I would not have none of that. Even now, like she's 21. She goes to the hospital. She don't even go to the hospital like that. She takes Toradol and it kills her pain. Like I have her messed up because my parents didn't know anything. With me and my sister, they didn't know anything. So we went through what we went through, but I'm not gonna let my child go. So I had some knowledge of it once. And she was
yeah. And they said that them giving us Toradol. Now this is what my doctor told me the last time I was in the hospital. She was like, I'm not gonna allow you to stay on it for any longer than 48 hours. And I was like, why? She was like, because it's not good for your kidneys or something. She was saying. She was
yeah.
like, it's not
They
good for
don't
you. You
they
shouldn't
don't
be on
care. They
that
don't
for any
care.
longer than 48
With
hours. And I was like,
her,
wow, like I never knew that.
And I'm
she doesn't
Like,
allergic
I
to
don't
it,
want
and
no
I didn't even know
Toradol.
that. So that's
Like,
she
why are
crazy.
you
doesn't
giving me
take it.
strong ass Tylenol? Like, I don't
She
want no
doesn't take
Tylenol.
it.
Don't give me no damn Tylenol.
She doesn't
She
take it
was
like
giving
that.
it to me
She goes to
for
the hospital.
information, along with the Dilaudid. So it was just like
Yeah.
to keep down information, like
Yeah,
to make sure, like that type of stuff. But she was like, I can't leave you on it for, any longer than 48 hours. And I was like, why? She was like, because it affects your kidneys. I was like, now all these years, they never even told me this.
right,
Like a lot of the
right.
times they would try to keep you on it your whole hospital stay.
The
And I'm
whole
like,
Yeah,
that's
she
hospital.
don't. But
And then
she's
you have
never
to
been
watch.
on
Another
it
thing is you have to watch the cocktails that they give
that
you
they're
too, because
giving
that
you.
shit'll get you hooked too. Because remember I
Yeah,
told y'all about that cocktail they gave me with the Ativan and Dilaudid.
yes,
Oh my god,
yes. I
they
remember
gave
yeah,
me
that.
that shit, and
yeah. I had that too.
I
I
was
was
like,
out,
listen,
Thank
I
God.
told the doctor, I said for my
Well,
out.
own
I
best
gotta go, y'all. I'm
interest.
sorry. I'm sorry, y'all. I gotta
Okay,
go.
well, thank you
All
for coming
right,
on.
Bye,
Okay.
James.
All right,
bye.
Yeah, I
Yeah,
told
those
the doctor for
cocktails are
my own
crazy.
best interest, do not give me any more of that because I will be stalking you. I'll be in the bushes in front of this
Mm-hmm.
hospital. It will not be nothing wrong with me, and I'm just gonna want that cocktail. So please, because I asked her again. They gave it to me because I was I didn't want any Benadryl. I don't like the way Benadryl makes me feel. It makes my heart race, and they
Me
felt like they
either.
needed to give it
Yeah.
to me because I had hives, and I was like, no, I don't want it. If you're gonna give me like point something. That's what I told them. And they're like, and I heard them. You know how you can hear them talking, and I heard them talking like she's freaking out. Give her some Ativan, like give her some Ativan or something, because she does need the Benadryl. They didn't want to give it to me. I was like, can I have a pill for him? They was like, no, we want to give it to you IV so this can hurry up and go away. And so they came in and they gave me that Dilaudid first, and then after that they pushed it. They pushed the Ativan in and they flushed it together. And baby, when I tell you that shit hit me, and I was in there like, what is this? What crack cocaine feel like? What the fuck? What is going on? Like, oh my god!
You got
And
no
then,
sense.
and then I was cool. I was cool. I was fine. And then like 10 minutes later, I was like, nurse, hey, you think I can get some more of that Dilaudid and that whatever that Ativan? Can you ask her to make sure I get the Ativan too? on top of the Dilaudid too. And then I hear them whispering again. They like give her one more dose. After that, don't give her shit else because she begging for it way too much. And I told them like, you know what? I hear y'all whispering. Y'all right. Don't give me no more of that shit. Cause I'll be in here stalking y'all. I'll be at y'all damn door
Yeah,
behind that. So
they
y'all
gave
have to be very
me
careful with
that
those
shit.
cocktails because they are
Yeah,
addictive. All right.
Yeah,
I had
yeah,
that. I had that when I had to have a CAT scan done, and I was like freaking out because I didn't like being in tight spaces. So they was like, "All right, we're gonna give you some Ativan." I was like, that was the first time I ever had it, and I was just like, "What the hell?" I said, I can't do it. I don't like I get scared. I get scared when I feel something feel when they give me that medication. I don't care how sick I am. I always ask them, "How much you giving me? How much is that? How much tablet you give me?" Because one time they gave my sister 10 milligrams a day in the hospital, and when I tell you that she was knocked out the whole fucking day, 10 milligrams, they could have overdosed the OD her. I ain't never in my life heard no shit like that.
Wow.
So I always double and triple check, like how much medication are you giving me?
And
Because I
ask them
can't deal
and
with
always ask them what they're giving you because it's been times
yeah.
nurses that came in there and had your roommate shit and your stuff and have it mixed up. And
Uh,
that's another reason that now they have to they go through the Pixies and nurses have to get, write off on stuff and everything like that
yeah.
because
Double
it's been
checking.
times and then it's been times where before the Pixies, the nurses used to waste the medication in themselves and I was attested to
Yeah.
that. I used to see that too,
There's
So
a lot of that in my hospital. Yep.
yeah, it was a lot going on at this hospital. That hospital used to be jumping. This lady damn near passed out. It was a nurse in the bathroom, passed out. She wasted. She gave some medication to a patient. They didn't want the whole dose, and instead of now when they don't want the whole dose, you have to write off on it. They have to dispose of it or whatever, or get permission or whatever. But I don't think they can hold on to it anymore. It's either you're going to get it or you're not. And
Yeah.
so um, she went in the bathroom and wasted the medication in herself and passed out.
The
wow.
fucking thing.
And that goes on. That
That's
happens a
karma.
lot. Like addiction, addiction pertaining to medical professionals, like the nurses and doctors, are more common than we think. Like a lot
Mm-hmm.
of them do be in rehab. A lot of them, when you catch the RNs who who can't push medications, a lot of the times it be because they've gotten caught, stealing meds. And so
Mm-hmm.
because I had a nurse like that one time that she was an RN, but she couldn't push meds, and I'm like, why she got to go get a whole nother RN to push meds, and she's an RN. Well, after I watched the documentary about it, I was like, oh, okay, so this is why you have RNs who can't push meds at all. It's a part of their, I think, like diversion program that they go through. Like
Mm-hmm.
they'll be able to keep their job, but they'll have to go get another nurse to pull all their narcotics for them. And so I was like, wow, that's crazy. And so
Mm-hmm.
I'm gonna get ready to close out. Are there any other comments, questions? Is there anything that y'all would want the community or the world to know about sickle cell? Any misconceptions that y'all would like to clear up? Anything that y'all want to comment on? Y'all have the floor.
Nope. I just want to say all of us are not the same. All of us are not in the hospital every freaking week. We do live productive lives, go to school, raise our kids. We are normal. We just have this position that prevents us from, sometimes doing everything that we want to do and everything that we want to accomplish, but we still strive and do our best. So when we get sick, medical professionals out there, when we get sick, do not judge every person as an individual. We're individuals, we're not a group. Just
Yes,
take that into accountability. That's
true.
all.
Anything you want to add, Lucy?
Um, yeah, I can piggyback off of that. Just as far as when we were talking about addiction and certain advocates being addicted or whatever, and they use the emergency room so much. I just want it to be known that that's not every sickle cell patient, like she was saying. And it does make it difficult for patients like me who don't go all the time. You know what I mean? Because they try to judge us, and that's why I feel
Absolutely.
like it's not fair to not treat them, because it could be days where they are actually in pain, and that's why I feel like, and what you touched on, Nita, that there needs to be some type of set protocol, so there isn't so much judgment and stigma in the hospital settings when it comes to us getting these narcotics and getting proper treatment. And like she was saying, like Katrina was saying, not just throwing the medication at us, give us a whole workup, because it could be so many other things going on with you. And if you don't have a doctor who's trying to give you a whole workup and they're just throwing medication at you, I know you're in pain, but you need to voice that. I cannot tell you how many times me or Nita, I have to advocate for a warrior, and they're not speaking up. They call us first to speak up on their behalf. And we always have to ask them, well, what did you say first? Did you ask for this first? Did you say anything first? And majority of the time, it's no. They're scared to speak up, or they don't know what to say. So I would suggest, I was lucky enough to have a mom to educate herself, and I was educated, and I was not lucky enough to have a great pediatric hematologist who educated me. But if you're not lucky enough to have those things, educate yourself. And I'm still educating myself. I don't know everything. Things change every day.
Mm-hmm.
You know what I mean? These medications change every day. I could go into the
Yes.
ER tomorrow and they could try to give me ketamine. Luckily, I know what it is. You know what I mean? Because I've been educating myself to know these are things that are definitely not going to work for your body. So make
Mhm.
sure you speak up, make sure your voice is heard, and make sure you ask questions about what you're getting, because they sometimes they make mistakes. Nurses aren't robots or machines or whatever. Sometimes they make mistakes. So make sure you ask what you're getting and how many milligrams it is before they even begin to push it through. And so you're going to get some resistance from some nurses. Like, they might get a little attitude, but you need to let them know, I'm doing this just to be safe, because I don't want any mistakes. You know what I mean? It's my life. So you
Protecting
need,
both of us.
yeah, you need to speak up and make everything known and make your voice known. Period. A lot of us don't speak up, and that's when a lot of wrong things can happen. So that would be my advice.
Exactly. Anything you want to add, Shay?
Um, the one thing that I would just add, and it was mentioned in the conversation earlier, and I didn't get a chance to jump in, was when we talk about being um, like it seems like we're working with the doctors and we have kind of like a docile type of attitude because we want them to feel like we're working with them. I think that that is a psychological ploy that is used against us to say that if we ask questions, if we try to dictate our own care, that we're looked upon as being belligerent, or we're looked upon as being um, uh, going against the grain, if you will, and not going along with the program. So, again, these are the labels that are placed upon us by healthcare workers when we try to look out for ourselves. So, yes, it is important that we speak up. It is important that we ask questions. It is important that we advocate for ourselves, because if we don't advocate for ourselves, who's going to advocate for us? Yes, I remember Leticia had said that the first time she had to go to the hospital without Matt, she was very upset. But there's going to come a time where each of us may not have that support that we are so used to. Because I used to call my mom a pit bull in a skirt. Anything that went wrong, She was on it. She was at the doctor's station. She was at the nurse's station, and she would not let up. But then there became a time where I would have to be that way for myself. Thank God that I had found Hush at a time where it did not work for either one of us. And Miss Bonita was able to get the ball rolling. But there is going to come a time where we have to advocate for ourselves. And as Katrina said, and as Courtney said, we're all not the same. I had a nursing supervisor when she first started on my unit, and she said how she was so proud. And as a matter of fact, she was the emergency room navigator, and she was very proud of the fact that when a warrior came to the emergency room, she told that warrior that you're not getting treated here today. You were just here last week. You're not getting treated. And because Montefiore here in New York is a big hospital system, she called the other hospitals in the Bronx to notify them that, this particular patient was coming and not to treat them because they are a frequent flyer. Wow. Now, I was the team leader at the time when she came in as our manager, and I was very proud of my team that none of them mentioned that I had sickle cell. And one day I had gotten sick at work, and the assistant director came to my manager and said, "Oh, but did you know that Sharon has sickle cell?" And she says, "No, she doesn't have sickle cell." She says, "Yes, she does. And, she's going down to the ER or whatever." So when we finally had a chance to converse, she was like, "Oh, but you're not like them." And I'm like, "I don't understand what you mean by like them. What does them mean? What are you talking about?" She's like, "Oh, you're just not like them." I said, "I need you to clarify." So she says, "Oh, well, most of them, they don't work, they don't this, they don't that." I said, "I don't know where you got that information from. Many of us are professionals. Many of us have children. Many of us are raising a family. Many of us have acquired higher degrees than some of you sitting here. And when you say you're not like them, I am them. So when you are referring to them in that manner, you're referring to me. And I refuse to be put in a box, and I refuse to be labeled." And I found out later on why she was so angry, because just like the doctor that was treating Courtney at that hospital, her husband had an accident, and her husband became dependent on narcotic medication. And he was not getting treated the way that she thought that he should be treated. And so because of her anger, she was taking it out on warriors. So, it's important that we all speak up for ourselves, be advocate for ourselves, and also to know the chain of command. Know who you're supposed to speak to if you don't get what you're looking for. Speak with the nursing supervisor. If you can't go there, you get to the manager. Go to nursing administration. If you can't get through at nursing administration, then you're going to go to the medical director. You have a protocol that you can follow. And don't be afraid to write letters, because letters change things. If you have to write a letter to administration, write the letter. If you have to write a letter to the Department of Health that oversees that hospital, write that letter. It changes things. They might be angry, but they can't retaliate against you. It really does change things.
Mm-hmm. Okay, so sis summed it up perfectly. I would like to thank everybody for tuning in. My suggestion would be to educate. I think that it is really sad that a lot of us don't even know the genotype that we have. You will be surprised about how many people I advocate for that had no idea what their genotype was. They didn't know whether they was SS, SC, beta, thal. They had no idea. I thought that was really sad. So one of my suggestions would be, just to really educate yourself about it. I was gonna have my mom to come on live on this show, but I think that topic deserves a whole nother show. So that way, I can kind of interview her and ask her more questions about what her and my dad dealt with, just having a sickly child, just getting her perspective. Because like I said earlier, when I was younger, I didn't quite understand, why I was having so much pain. All I knew is that I was sick and I was in pain. That's all I knew. And, like I thought that I was a burden to them. Although I knew that I wasn't. You do have those feelings of anxiety, depression, sadness, anger. Sometimes it was resentment. Like why me? Why am I the one that, out of 10 kids, why am I the one with sickle cell anemia disease? So you go through a range of emotions, but I'm thankful, that I was the one that was chosen, to walk this journey, because I honestly believe that it made me like a stronger person. We're strong people, whether we know it or not, whether we realize it or not. A lot of people would not be able to walk a day in our shoes. And so, instead of me wondering about why I was chosen for this particular journey and assignment, I decided to embrace it and, to accept the good with the bad. And that's my advice, is, not to allow sickle cell anemia disease to deter you from accomplishing anything you want to accomplish. I have a bachelor's degree in applied psychology with a minor in forensic psychology. There aren't many people without sickle cell anemia disease who have a bachelor's degree. And I was able to graduate with honors. That's something that I'm very proud of. And so, I try to live my life to the fullest, safely. I would say learn your triggers, learn what triggers you to get sick, so that way you'll know what not to do, to stay healthy. You'll know, you have to, in a sense, learn your body, because I've learned over the years that your body does talk to you. It gives you signs when you need rest. It gives you signs and symptoms when it's sick or about to get sick. So I've learned to listen to my body. Now, that has been a task. It's hard because y'all know I hate drinking water. I just do not like water. But I learned those triggers, and I know those triggers. And so, now that I know those triggers, I know what to do not to get sick. And I think that that's really important. And so, piggybacking off of what I said, I would say, to live your life. You only get one life. Once it's gone, it's gone. You don't get to any do-overs. You don't get to do it over. And so stop using sickle cell anemia disease as a crutch, as an excuse. I know I've done it too, but there's this big world out there just waiting on you to enjoy yourself. So I would say always live your life to the fullest. If there's something that you want to do it. Don't allow this disease to have so much power over you that you end up missing out on the simplest things in life. That is my advice. My advice to the medical professionals would be, just to stop grouping us up. Stop putting us all in one bunch and thinking that we're all the same and that our bodies are all the same because we all have the same illness. Absolutely, we do. We all have sickle cell anemia, but our bodies are different. Our bodies respond to pain differently. And so, you can't expect me and Shay, for instance, to have necessarily the same symptoms or complications because our bodies are different and our bodies react to different things in our environment, our life, etc., differently. And so that would be my advice, and get to know us. Like, I remember being a patient and my nurse friend, she was my nurse, and they made me out to be like a disgruntled patient. She was honest with me. She told me, she was like, "Girl, you just told opposite of what they told me you would be." And so that would be my advice as well. Like, stop prejudging us, and without getting a chance to know us, because you may be surprised. We may end up becoming a good friend of yours, or whatever. You'll never know if you're prejudging people, and just learn to have more compassion and sympathy and empathy, because pain is subjective. What may not kill me may kill you, vice versa. Who knows? But just really try to start individualizing us versus grouping us all together, and just stop the preconceived notions and stereotypes, and really learning. I want them to really learn, to sympathize and empathize with us, because we could have been your family member, we could have been your son, your daughter, we could have been your wife, or could be your wife. You never know, and so it could be somebody in your family at any given time. And so that would be my advice. I want to thank everybody for tuning in. Sis, I'm gonna go ahead and drop you off. I thank you for coming in. I thank everybody for tuning in. Shout out to my sister, my big sister. She got a master's degree, and so I want her to come in and talk a little bit about, the emotional and psychological impact that we have. And y'all will be hearing more from her, as well as my other sisters too. I'm thinking of doing maybe a sisters panel and bringing my mom on, just so that I can interview them and get their perspective, and really y'all can really hear from them and hear, what I went through as a child. Like, who better to interview than my family? So look for that upcoming interview. I don't know when it will be, but it will be soon. I want to thank everybody who came on the panel, everybody who showed up. I appreciate y'all so much, and I will be back again. I had so much fun, y'all. Good night.
Oh yeah, sickle cell been kicking my ass lately. But you know what it is. One day at a time. Oh, this shit's on small. Wants to jump in this. Look. Sickle cell to the bone, sickle the rest. I done put her in the back, still feeling fresh. You could never check a nigga that'll check death. My own body seems to hit me. So I love the place. Got a cane from the pain, it's just the pimp step. The only time you see me down is when I'm beating it. Like a man, you can go up. Steps, phone friend, drop the bomb on niggas next. Sickle cell, sickle cell. Raising hell in my body, yo. Sickle cell, sickle cell. Every day different pain, so I'm tired, bro. Sickle cell, sickle cell. Fuck you, I'm still gonna be the flag, though. Sickle cell, sickle cell. Raising hell. Tells the time on, they ain't see the flying squad. Without a wanted pin, receptors ringing no alarms. Still calm, another battle in the ER. Doctors hate when it's ER. Another addict, make me ask for the seesaw. Up and down, closer to the reaper. Sorry, but I hate to be out. All the seekers, no other keepers. This shit is super. Shit, I'm just speaking to speakers. Sickle cell, sickle cell. Raising hell in my body, yo. Sickle cell, sickle cell. Every day a different pain, so I'm tired, bro. Sickle cell, sickle cell. Fuck you, I'm still gonna be the flag, though. Sickle cell, sickle cell. Raising hell in my body, yo. Your life, I know it's painful through the fight. Gotta make the most, we warriors for life. Keep right, dream big, take flight. Aim for the stars, shine brightest through the night. See them doctors, we all stand up for our rights. Never take a knee, I'd rather smack the burning stripes. Sickle cell turn, just put me in the fight. I'm out gracefully, you know I'm on the side. Sickle cell, sickle cell. Raising hell in my body, yo. Sickle cell, sickle cell. Every day a different pain, so I'm tired, bro. Sickle cell, sickle cell. Fuck you, I'm still gonna be the flag, though. Sickle cell, sickle cell. Raising hell in my body.